to your viewers. Yes, fortunately, we have been through this before, and we've sort of managed to, with the challenges that it came with. I think the biggest problem is that of numbers. From our side, it's very difficult to control the numbers at funerals. As you know, especially in our African funerals, people are not invited to funerals. People just pitch up. And it's always a challenge to try and speak to the people that there cannot be so many people at the funeral. And at the end of the day, it becomes the responsibility of the family as well to work with us. So those are some of the challenges that we have, especially with the numbers. And also in terms of the turnaround time, the 5 days, it is appropriate, but we have problems when it comes to registering deaths, such as home affairs. I understand even yesterday some of the home affairs offices were closed. So this poses a challenge in getting the documentation ready for burial, as well as some of the municipalities, the turnaround time for booking of a grave, it's 2 to 3 days, which is sometimes a challenge.
And what's changed in the manner in which funeral services are conducted, especially when one has passed on from COVID-19?
Well, for what we have to apply, like putting a body in a body bag and making sure it's viewed under hygienic conditions and safe conditions, and the body doesn't go home the night before the funeral as a norm amongst our people. And also, there's no night vigils as well. So normally the body will go home in the morning, perhaps for viewing a service. And as you've seen in the gazetted condition that a funeral service can go maximum of 2 hours. So in some areas, it poses a challenge because the time that it gets to drive from home to the cemetery and the time it takes to cover the grave, it might be beyond that 2 hours.
And funeral parlors are also run by human beings who also may be exposed to the virus. What contingency measures have you put in place there to ensure that staff members are also not affected by the virus?
Well, we try by all means to make sure that our funeral staff, they always have enough PPE with them. They wear the appropriate equipment so that they protect themselves. And we also communicate with the families because unfortunately, families are reluctant to disclose the COVID status of their loved one. So it becomes a challenge. Hence, we're treating everybody as potentially COVID infected. In actual fact, in the past couple of days, I've heard of some of my staff, they were saying that the one family was actually complaining that why are they wearing full PPE to remove a body? They give other people an impression that it's a COVID, and they try to explain to them that this is how we have to do things to protect ourselves and yourselves. So it is a challenge, especially with home deaths. And because some of them, they're not tested, so you don't know their status. And some of them are tested, but the families refuse to disclose. So it becomes a problem at the end of the day.
You've spoken, Dr. Konyana, about the processes and the challenges that you're experiencing there, but we're also learning as the daily death rate increases across the different provinces. One funeral association, funeral parlor in the Eastern Cape, speaking about how they are slowly but surely running out of coffins as funerals are held daily as a result of COVID-19. And also another instance was that one funeral parlor speaking about how they're now being forced into ordering larger coffins because witnessing an increase in the number of obese or perhaps overweight people dying from COVID-19.
That is absolutely true. We have, I think most funeral parlors have experienced such. And in terms of coffins as well, it's a problem, especially around this time, because most manufacturers are on holiday. And we have urged some of them to maybe not to go on holiday so that they can manufacture so that we have stock in hand. And that's one of the biggest problems. Most of us had to stock up before, but we're still scared that we might not make it at the end of the day. We might need those manufacturers to come back early.
And in another instance, one funeral association has also spoken about how they're now having to think outside the box, converting shipping containers into mobile mortuaries. What are your big challenges in that regard? And are you thinking as far out as that?
Well, I know some funeral parlors have done that and successfully so. As long as it's done safely and it can be safe and it's in line with the regulations, I think that is fine. But most of the funeral directors have increased their storage capacity. And also I think the 5 day for burials also makes it easier for us so that the turnaround is a lot quicker so that we empty our fridges as quickly as possible.
Now, funerals are really the last send-off for families to bid farewell to their loved ones. And earlier on, you touched, Dr. Konyana, on the process that now has to take place, especially when you know that one has passed on from COVID-19, that you no longer are bringing bodies the night before, but you're doing it all in the morning at a very short space of time. Talk us through some of the emotional, aspects that you're dealing with, the psychological factors of this process.
I think one of the biggest problems is that, death is always a difficult thing, especially for the family, for the loved ones. And in most cases, because we're so used for body coming home the night before to say our goodbyes or in certain circumstances to perform certain rituals. And now this makes it impossible. So now and then, and families sometimes tend to think that it's us who are imposing those regulations. And we try to explain to them and also tell them, about the safety aspects of it. But sometimes some families understand, but some don't understand. It is really difficult during those times. But we try to do the best that we can, and we hope that the authorities will also work with us. Now and then we've had to call in authorities to assist us in that regard in speaking to the family to communicate the message. But I think the more the message is communicated and it's loud and clear, it will be more understandable because people do, and there has been funeral parlors, they have been pushed to a point where they end up delivering that body home the night before, even if it's COVID infected.
Very well. Thank you so much for talking us through that, Dr. Lehlohonolo Lawrence Konyana, President of the National Funeral Directors Association, speaking to us about some of the challenges and concerns as the lockdown level 3, also exploring the impact on the funeral business as well as the impact on those who are laying their loved ones to rest.